Hello and good evening to all my friends out there. Is my voice clear and audible to all of you? Sarah,
Yeah.
Girika,
Yes, Dr. Sandhya.
Rahma, can you all hear me?
Yes.
Thank you very much, Arshaba. Thank you. So, very warm welcome from my side to all of you today. So, most awaited introduction we are going to have today. How's everybody doing? I hope you people are safe. Hope you people are having a good time at work and with studies as well. Are you? Hello. Yes, Girija. Thank you very much. Thank you, Liana. How's everything going? Hi, Devya. I hope you all are doing good. And we wanted to meet today before the formal sessions to tell you that how the things would be going, how you have to prepare in a focused manner. MRCOT Part 3, many of you know that how does it go, the exam, the curriculum. And again, students, they can't make it in first go. So what's the reason behind that? We are going to touch all those reasons today so that before we formally move to the sessions, we are aware that where do we lack or what are those points where we need to give more attention, right? Thank you very much, Rahma. So you all know about MRCOT Part 3 up till now, that we have modules. I've got 2 or 3 students with me who are yet to begin. So for them, we've got 14 modules, right? Now, here I want to clarify all those concepts or those points which you're not aware of. When you see the previous exam pattern, it's not necessarily that every module you all are going to get one station from. There can be an overlapping as well. There can be 2 stations from teaching at times. There can be a missed station from sexual module at times. Generally, when we do the preparation, we do the preparation in this manner that we touch each module and we are satisfied that yes, we have a good command over this module. So we start with teaching, core surgical skills, post-operative care, antenatal care, the maternal medicine, management of labor, the management of delivery, postpartum problems, the gynecological problems, subfertility, sexual and reproductive health, early pregnancy care, gynecological oncology, urogynecology, pelvic floor problems as well, right? What we are going to do together in mini groups is that we'll pick up one module and I'll tell you about the important stations which had been touched earlier by the college, and you have to prepare those stations for the next week session. How you're going to do that, I'm going to elaborate everything and we'll make it very clear today so that you start preparing on throttle from today onwards. Okay? Now, who is here who does not know even the exam pattern so that I can go into detail? Anyone? Where are the participants? Okay, so Ayan, Rashid. Actually, few of the names are changed. So I would request that you keep the same names as that of my students so that we are able to communicate, right? Okay, thank you very much. Fawzia, are you here? Yes, Fawzia is here, right? And Doa, are you here? Okay, thank you. Right. So what I wanted to tell all of you is that see, it is a fight against the time in the exam. So outside the cubicle, you have to be a fast reader, and this is what we are going to practice from today. Right? From today, we have to practice this thing. It's not that you're going to read a station in leisure. You're going to be a fast reader that is picking up each point in 2 minutes. That's important. Rather, in 1 minute time, you should complete up your reading, right? And after 1 minute, you formulate the plan. Before getting into the cubicle, going inside the cubicle, you all should be ready that what are those lines for which you have to start your station. My emphasis for all my students always is that they should have a very composed and a confident start, and their ending should be perfect. Why? Because starting is the time when examiner sees that, okay, so this is a pass candidate, all the confidence from head to toe, you can simply give an impression in your first 2 minutes. Again, examiner has a keen look when you're leaving the cubicle because that's the time when he picks up the pencil and marks you, right? So my always stress on this preparation is that your starting should be perfect, and we are going to make it clear today that how we have to enter into the cubicle. Then your ending should be perfect. Somewhere in between, even if you create some mistakes, that is acceptable only when your ending and starting is going to cover it up. Did you people get my point? Students, when they enter into the cubicle and they start fumbling from the start, believe me, this fumbling goes on till 10 minutes. And students who are making some tiny mistakes in the applied clinical knowledge in the center, and they have a very good start and they have that ability to cover up that confusion or that mistakes in the middle, believe me, they manage to pass the station. Am I clear, Harshaba, Rahma, Fawzia? Did you get the idea that where we have to be perfect to make a good start, where we have to impress the examiner because it's a competitive exam? My students, they know that I always say that if one student has to pass in the circuit, that should be you. That means your preparation should be at the level that basically if one has to pass, that should be you. It is a competitive exam, right? In a 14 student circuit, in a 14 candidate circuit, they cannot fail all of them, right? Even if it's the worst of the stations exam, even then they have to pass like 2, 3, or 4. They have to maintain the result. So why not to be at the top strata? Why not to be the best out of them so that there is no point that even the worst exam comes, we are going to be the best out of that difficult exam scenario as well. Did you people get that? Right? Now, general guidelines, I would tell you about the domains where you people have a little problem. Outline of the exam, you all know up till now that it's a circuit. It's a 14 station circuit. We have a 2 minutes reading time and a 10 minutes actual time, and it all goes in a go. There is no break at all. So total of 168 minutes. These are the fastest minutes of your life. You have a palpitation and breathlessness in the beginning, and as soon as you start your circuit, you get your breath back once you complete your 14th station. It happens. I'm going to train you in a manner that this nervousness we have to overcome. There should be no fumbling. The continuity, the flow of speaking should be perfect, and it would all come with practice. Okay? We have role player stations, friends. It goes from Midhat. There are role player stations. There are simulated patient tasks, right? And then we have got lay examiner stations as well, and only with examiner structured discussion as well. So far, the college is sticking to the same pattern. That is, it's going to be 4 structured discussion. 4 structured discussion means that you're going to be with the examiner, right? There are going to be 4 layman examiner stations. That means that 2 examiners are going to judge you for the same station. And then we have got 6 the simulated patient task without layman examiner as well, okay? There is no preparatory station. There's no breather in between. It's 2 minutes, 10 minutes, 2 minutes, 10 minutes, 2 minutes, 10 minutes, and it goes on for 14 stations for which we have to make our stamina, and we should not get exhausted. Gradually, in the last 2 months, I'll give you tips that how we have to work over that, okay? Now, whenever it's a lay examiner station, and if you manage to pass that station, the chances of passing the exam is very high. Why? Because the scoring of the lay examiner station is maximum. Are you all aware of that? Do you people know about this? How do you come to know about the lay examiner station? Anyone? How do you come to know that this is a lay examiner station? Harshiba?
Ma'am, there are 3 people inside. So there'll be a role player, there'll be the actual examiner, and a layperson.
Okay. This is when you enter into the cubicle, right? Outside the cubicle as well, the top line of the station says it is a structured discussion. It says it's a simulated patient task, or it says it's a simulated patient task with the lay examiner. Okay. Right? So in 2 minutes, you come to know this is the first thing you all have to see outside the cubicle. Whatever I'm saying today, you people will see that you people make mistakes in the performance of the station. Why do I emphasize on that? Because entry into the structured discussion is different than that of a simulated patient task. You all are aware of that. And it happens every time that you don't see it's a structured discussion and you start introducing yourself as a doctor in one of the clinics and the examiner says, hi, it's a structured discussion. So you just lose all of your confidence there from the start. So please, are your notebooks ready for the notes to be taken, everyone? Your notebooks are in front of you. The first thing which I'm going to tell today, which you all have to practice in the live sessions, is that the first thing you have to write down is that please see what type of station you're having. And this is outside the cubicle. Is it a structured discussion? Is it a simulated patient task? Or it's a simulated patient task with the lay examiner? Noted, everyone? Noted, everyone? This is the first point you all have to see.
Yes, Dr. Sita.
I'm starting from the basics. Why? Because I don't want that the level is changed when we start the practicing. I'm going to give you the lines today to enter, to exit, and I want that you stick to it so that we make a practice and it comes out from a spinal level. Okay? Second thing, Pallavi, you need to see in the station is what are the domains you're being tested for, right? What are the domains you're being tested for? Because keep these domains in mind, and I will tell you where you people make a mistake not seeing the domains. This is the second thing you're going to see outside the cubicle. The third thing you're going to see, candidate instructions and the tasks which you have to perform. So these three things you have to see in 1 minute time, and then prepare yourself how you're going to enter. For each domain, it's going to be a passing if the examiner sees that you match to the key. So it's going to be 2 scoring. 1 is for borderline and 0 is for failing, right? You all should be reaching pass for each domain to be secure in exam, because we have to pass this in this goal, right? Now, where do we face problems in these domains? I will start with 1 domain each, and we'll see that you are aware of what these domains mean. Why? Because from the next Friday, we are going to practice these live stations. So I don't want that anybody has any sort of query or confusion in these domains, right? Now, when information gathering is there outside the cubicle, what does it mean? What do you mean by information gathering? Do I have Dr. Sabia here? Dr. Sabia?
Yes, Dr. Sidras. Assalamu alaikum.
Walaikum assalam. Thank you very much. What do we mean by information gathering if it's there in the domains?
Information gathering, according to the case, we have to ask the history.
Okay.
History and examination.
Very good.
Relevant history.
Okay. Dr. Sabia is absolutely right, friends. Information gathering means that we have to ask history. We have to see in the examination if it's required. And one more thing, don't forget. If you have to seek for some information gathering in a station, remember, some investigations might be required to move forward. So information gathering requires a history, it requires examination, and it requires investigation as well, provided it's not given in the station. If it's not given in the station, for instance, for example, it's a heavy menstrual bleed. You take the history, you perform examination, the tummy examination from down below, and then you say, I would be sending few blood investigations and will send the ultrasound examination for you, right? Why? Because that's also part of your information gathering, provided it's not done in the station. If it's done in the station, then it would come in your applied clinical knowledge that you're going to explain that investigation findings. If it's not done, then it is part of your information gathering. Why am I explaining it today? That when we'll do the stations, you should be knowing what this domain means to us, what this domain means to the scorecard of the examiner. Am I clear? History, examination, and investigation, if not done prior to the applied clinical knowledge or to the management, this is part of your information gathering. Clear so far?
Yes,
What
yes.
is information gathering? Very good. Now what we are going to do today is that we are going to fix information gathering. I do not want any fumbling in the information gathering, because when we know that it is part of the station, why not to be super smooth in the information gathering, please? See, your first 3 to 3.5 minutes or maximum 4 minutes for some longer, bigger module stations, it is the information gathering. Why not to fix it? Why not to cram it up? Why not to speak it like, 3 times a day to make it smooth, right? Now, let me make it easy for all of you, and we are going to do it in this manner from today, 3 times a day, daily. Information gathering, friends, should not exceed more than 4 minutes, because then it starts taking the time for the other domains, right? How do we start? The first thing, you have to see what is the presenting complaint, what the patient has presented to you for, right? This is known as history of presenting illness. This is the first mistake you people do, that you jump up to the other types of histories first and you miss the complaints. So the first question would be for the complaints. For each module, I will be giving you the questions for each module prior, 1 week prior, so that you can practice on that 1 week earlier about the history of presenting illness, because this is the only thing which will be different in all different types of stations. Rest, the information gathering is the same, right? Now, if it is an obstetric case, that is maternal medicine, antenatal care, or for that matter, early pregnancy, you're going to take obstetric history first, right? Obstetric history first. Ask about the previous pregnancies, how they were delivered, how were the recovery. That's it. Then you ask about the gynae history. What do you ask in the gynae history? The periods, the menstrual cycle, is it regular? If she is more than 25, remember, ask about the smear. And if she's practicing any contraception, if she's pregnant, of course, you're going to leave this question. Now, less than 25, please do not ask about the smear. This is again a mistake which students do in the flow, because they've crammed it up that, okay, we have to ask about the smear, and they don't see the age, and they ask like, did you ever have, what was your last smear report? And the patient says that, I'm not 25 yet. Again, you start fumbling. So please see the age. If it's more than 25, yes, it's a patient safety asking about the smear. And if it's less than 25, you can omit this question. When I will be reaching in antenatal care and maternal medicine, I will tell you in that specific template that where you can skip smear to have a focused history, and where specifically in pregnant patients like an HIV or the renal transplant, you need to ask about smear as well. So this is the basic template. We have to alter this from different modules to modules, and I will be guiding you specifically 1 week prior to that specific module as well, okay? Now I want a very good flow after this. This comes with practice. Once you're done with the gynae history, asking about the menstrual cycle and the regularity and the contraception and smear, you have to come to the medical history. Now, how I used to memorize it for myself. See, we do ask the medical history. You can ask either like, is there any medical illness and for which you see your GP regularly, right? After medical history, my way was that I asked for the medical history, that is medical history in the person, the patient, then medical history in the family. So this is how I used to connect medical to family so that I don't forget. This is this connection I'm making you learn so that it comes out spontaneously. So any family history of concern. Then after medical and family history, I used to come to the surgical history. Any operations on your tummy or below down in the past? When we have a surgery, we take medicines, right? We take medicines, right? So are you currently taking any medicines? Do you have any known allergy? And so I used to connect my surgery to my drug history. Immediately it used to ring in my ears that I'm not going to forget drug because I've asked surgery. Now I have to come to drug history. Then you ask about the personal history. Here I have to again tell you guys that do not do signposting before personal history. It takes your time. You can ask directly. You can ask simply like this, that may I know, Anne, do you smoke? Do you drink alcohol? Or pardon me to ask, any recreational drugs? So before recreational drugs, you can do a little signposting, okay? Pardon me to ask, any recreational drugs? But this is a smooth way of asking that. Don't do a big signposting before that. It starts taking your time because you have to complete it in 3.5 to 4 minutes, right? After personal history, come to the social history. So what do you do to live, Anne? And has the support at home? How have you been feeling in the last few months? Now your information gathering gets completed. These all questions with this same sequence, I'm going to check you all that how is your flow? Does it come one after the other spontaneously, or you start fumbling? Do you smoke, drink alcohol? Any family history of concern? What about your periods? Now this is a wrong way. This comes only when you do not practice. jumping from personal to family and then gynae, and then asking about the kids. Am I clear that I want a perfect sequence? I'll give you lines wheresoever you require, but continuity, the flow should be perfect, one after the other. And it would come with practice. You all would be superb only if practice and linking up the history with each point. Let me give you my words, that 3.5, 4 minutes. If you do it in a smooth manner, examiner passes you at that time. Right? He comes to know that this is a well-rehearsed candidate, and he can see the difference between the previous candidate and the candidate coming next. You have to stand out in your information gathering, all of you. Am I clear so far? Rahma, Harshaba, Fozia, Girija, Jyoti, everyone?
Yes, ma'am.
Dr.
Yes,
Sarwat? Yeah? Am I clear?
Yes.
This is my requirement,
Yes.
all of you. Divya, it's presenting complaints. The presenting complaints, she comes with what? Right? What are the symptoms she has presented you for? Okay? Yes, Dipti? This is my first requirement from all of you, that you have to work over this, and I'm going to see the change. Graph of my each student has to be escalating. That has to go up. And I keep a graph on my notebook. And I tell you, like yesterday I was having the previous group, one-to-one mini group session. I told them that, see, one of the students, if in the next presentation, her score goes down, this is a concern for me. That means I am lacking somewhere, right? Your success is my success. And if you're failing at some point, that is not yours. That is my failure, basically, right? So I'm going to work on those points where I feel that you people are not all right. And you have to give me this opportunity that I might be a little strict at some times, because I need to keep the threshold of passing way too higher so that exam seems to be easier for all of you. All right? This is what you all have to practice. In abortion history, when you say that, may I know about your previous pregnancies, Bindu? So it comes in the obstetric history. Okay? When you say, may I know about your previous pregnancies? Bindu, I'm against asking multiple questions for one thing. I always formulate one question where the role play answers. So when you say that, may I know about your previous pregnancies? Yes, thank you very much, Sabia. I would, you all have to give me this opportunity, please bear with me, but I'll have to go in this manner so that you all have an improvement, okay? Right?
I have to ask one thing, Dr. Sidra.
Please, sure, my dear, please, yeah.
Yeah, till now, as how I am practicing, I'm always keeping drug history with medical history. So is it fine? Because it will be difficult for me to now change.
I
I'm
totally
very used to
understand.
doing
I
this
totally
thing.
understand. So what you do is medical history and drug, and then you come to family
Yeah.
and surgical?
Yeah, medical
Yeah.
history and drug, and then surgical, and then family. It is in my family I can bring up, but drug history, if we can
That's fine.
combine it
You
with
have,
medical.
see, what you have done is that you have associated it with medical. You'll never forget that. Keep going like that.
Yeah, allergic and medicine together.
Very,
with
I don't
medical.
have any problem. I don't have any problem, but missing it, I have a problem. Okay? Or making it like, then after doing gynae history afterwards, yes, then it's going to be a problem.
Yeah,
All right?
that is understandable.
I understand. Midhat, yes, there's a question. Raising hand, Midhat. Yeah. Midhat, you have raised your hand. Is it a mistake, my dear, or you want to ask a question, please? I'm open to all the questions. Let it be interactive. Yes, Midhat? Hey, Midhat.
No, doctor, my mistake, doctor. Thank you.
Your mistake, Midhat.
Yeah,
Okay,
yeah,
no
yeah.
problem, no problem, my dear. I was happy that you're coming with a question. Okay.
Thank you.
Dr. Sidra,
Yes, yes.
what about Dr. Sidra? This is smoking, alcohol, and recreational drug. It should be a one question. Do you smoke, take alcohol, and
Take a
recreational
pause.
drugs, or
Yeah,
it should be three questions?
make it one in a manner, Dr. Sabia, that may I know that do you smoke? Take a pause. Drink alcohol. Or pardon me to ask, any recreational drugs?
Hmm.
So
So
this
not to be, say a whole
no,
sentence.
don't wait.
to
Yeah,
waste
just
time.
take a little pause and just speak it in this manner, right? So if she comes up with the answer,
Dr.
yes, I
Sidra,
do.
what about?
Yes, my dear.
Yes, go ahead.
Yeah, I wanted to tell you, Dr. Sabia, that make it in one go with a little pauses so that if you can see a nodding or if you can see an answer actively, so you just pick it up. Okay? Right? Yes, Divya, please.
Yes. What about the BMI, Sidra? Do we ask
Yeah,
them?
yeah.
Do we ask them the
I will
BMI
come to
straight
the,
away, or do
yes,
we ask them
I
the
will
height,
come.
weight?
Yes, I'm coming to the, I will come to the sexual module template in the end because this is what you have to prepare. Every week at the end of the last session, I will give you the template of the next session, right? I will tell you in a general history, I used to keep, Dr. Athiya, I used to keep BMI, and Divya, I used to keep BMI in personal history. Now both is fine. BMI is fine as well. They know about the word BMI, but you can say, may I know about your height and weight ratio? This is an easy way. So if at all some teenager is there, if at all somebody who is a non-UK person who is in a station, maybe somebody who has come just here for the station says, so BMI at times they might ask, so may I know what that is? So it's better to frame your question in this manner. May I know about your height to weight ratio? Okay, height to weight ratio.
Okay.
So you can do that. My way was doing in the personal history, and then asking about smoking alcohol. I'll give you in the not in the general template, in the specific template just in a while. Okay, Dr. Athiya, BMI you can pick up in the personal history, and Jehovah's Witness is not in all cases. It is not in all cases. My way of doing Jehovah's Witness in specific modules, I will tell you, like in surgical modules, like in the post-op module, like where there's some sort of ectopic pregnancy and you think that the blood transfusion is to be given. So I used to keep it during the explanation in the HOPI, right? And I will tell you where you have to fix it. In those specific modules, I'll tell you that where you have to fix this in the Jehovah's Witness in the template. Okay, Dr. Athiya? Because in general template, you're not going to ask for everyone. In specific module templates, I will tell you that where you have to fix it. All right. Pallavi has a question that smoking, alcohol, recreational drugs should be one question with pause. Yes, Pallavi. Right? When we'll practice, you'll come to know that if I say, yes, of course, I do take cigarettes, then you're going to take a pause. How many cigarettes a day? Right? So then you're going to connect to the smoking cessation program at times. Again, if it's an emergency station, you have to skip few. I'm going to tell you that how you have to moderate and twist your history in specific modules just to be focused. I'm going to come to that. Okay. Now,
Dr. Sidra, one more question.
No, please. Yes, I'm here to answer questions today before we start the preparation. You know. Yes, please, Dr.
What about mental history? You wrote how had you been feeling in the last 6 months? Is that enough?
Only enough for a general case. When you have risk, for example, sexual assault, when you have risk, for example, any sort of patient who is in antenatal history and she has risk factors for depression, then you add your Wooley's question. But in a general case only, how had you been feeling in the last few months? That's sufficient for a general case, right?
So even in booking case of antenatal care, we will ask just this question or the
only this
specific.
Only this question. When I'll come to maternal medicine, I will tell you the high risk factors and tell you that where you have to add on more questions. Patient who is high risk for. Otherwise, only single question. That's it, right? And that too, in emergency scenarios, you have to leave this question, please. I will tell you in the surgical module, if a patient is having abdominal pain and you're asking, how had you been feeling in the last few months? This is unnecessary. You have to mold yourself. In emergency history, I will change this history. This is a general template you have to learn, and that I will tell you in specific stations from this general template where we have to twist and where we have to mold ourselves. Right? Okay. Pallavi, we don't have to ask blood group in every station. For example, in all gynae, or for that matter, in sexual module, we are going to prepare, right? In emergency contraception, it's not required, right? But yes, in antenatal care, when we'll come to maternal medicine, right? And when we'll come to any pregnant patient or any patient who is bleeding, you need to ask the blood group, and that would be coming in HOPI, okay? So in general, you are not going to ask blood group for every patient. This is an unnecessary question. But yes, a pregnant patient, it's a patient safety, my dear. So this is a general template. Then I will give you module-wise templates as well. Yes, Bindu, we have to twist according to the module, this general template, of course, right? According to the situation, according to the emergency, but general questions should be known to you so that you're able to know that how I'm going to move forward. If general questions you're not going to cram up, then it would be very difficult for you to mold these questions according to the situation. Okay? Right. Salma Al-Sabai is writing in the group that she cannot join in. Midhat, help Salma, please. It's a simple link. Click and join. No waiting room, nothing. Somebody can write in the main group for Salma to join in. Thank you very much, Rahma. Thank you. Okay. So now see that what actually communication with the patient and the relatives is. Please take out your notebooks because I have to fix your lines today. My way is that I fix the introduction agenda first of my one-to-one students. Why? Because I don't want fumbling in entering into the cubicle. Now, if you have fixed your lines, I'm going to listen to those lines so that there is no trouble that you make a big agenda, you make a big introduction. Today, we have to start with the communication with the patient and the relatives. What does this domain actually holds? Now, friends, information gathering is one part in 3.5 to 4 minutes. Communication with the patient and the relatives. Remember that it starts from the beginning. This is the most important domain which you're being evaluated in complete 10 minutes. No matter you're doing your applied clinical knowledge, no matter you're doing your information gathering, no matter you're doing with your communication with the colleagues, everything has communication with the patient and the relatives as well. So this domain is being tested for the complete 10 minutes. How do you basically have a skill to practice? You should know that how I have to inform the patient about the condition. You should know that how I have to engage the patient during the talk. You should know that how I have to negotiate in a better manner without making an offensive behavior towards the patient. You should be knowing that it should be a shared decision and don't be dictating in the station. Don't dictate to your patient, instead offer. Now, how do you get the ability to inform about the condition? We all know that we have got patient information leaflets from which we get lines from these different types of stations, that how we have to explain. This is, we are going to learn from the information leaflets. Engagement, negotiating, making a shared decision, it comes with practice with buddies, of course, under my supervision. Okay, so this is how the skills to practice we have to improve in communication with the patient and the relatives. Now, we have to start with the introduction that has to be perfect. Sarvat, please write it down. You've got a patient, Sam Phillips. She is 22 years and you are in gynae clinic. She's here with HMB. Make your introduction and agenda, please. I'm talking to Sarvat Faraz, sorry. I've got two Sarvats, I'm sorry. Yeah, Sarvat Faraz. Sam Phillips, 22 years. You're in gynae clinic and she is here for HMB. Make your introduction and agenda, please. No?
Hello?
Yes, please, go ahead.
Yes. Okay. Hello, I am Dr. Sarvat, one of the doctors in the gynae clinic today. May I confirm your name and age, please?
Yes, hi, doctor. Doctor, I am Sam Phillips. I'm 22 years.
How may I address you?
Yeah, Sam is all right.
Okay, Sam, I can gather from your notes that you are having heavy periods. For that, you came here to discuss your condition. Am I right?
Yeah, exactly, doctor.
Okay, so Sam, so as I'm seeing you for the first time, so is it okay if I ask few questions to know more about your condition? And then I may need to examine you, run few tests, and then we will discuss the mutually agreed and safe management plan.
Okay.
How does it sound to you?
Yeah, it sounds great. Thank you very much. Thank you. Right. Now, this is one sample which I've given to all of you from Sarvat, right? Introduction. I would like to tell you, somebody else would like to give an introduction the way she or he is practicing, so that I can come to give you the final introduction and final agenda making, so that you people don't fumble from station to station. Anybody? Girija? Anyone? Bindu? Harshiba?
Hello.
Yes, Harshiba.
Okay. Hi, I'm Dr. Harshiba. I'm one of the doctors in the gynae clinic today. May I confirm your name and age, please?
Yeah, I'm Sam Phillips, doctor. I'm 22 years.
It's nice to meet you, Sam. Is that okay if I call you Sam?
Yeah, that's okay.
From your notes, Sam, I see that you've been having a problem of heavy breathing. If it's okay, before we proceed further, can I ask you a few questions to know more about you, as this is the first time I'm seeing you? After that, I'll examine you and run through investigations. And we can come to a mutually agreed and safe management plan for you. I would also like to give you a few information booklets for you to go back home and read.
Okay, thank you. Did you people notice? Did you people notice that Sarvat and the Harshiba, when they did the introduction and agenda, their idea behind was the same, but words were different. If you see that Harshiba said, "Nice to meet you," and if you see that Sarvat said that I would also like to examine you in the presence of a chaperone, may have to run few tests in the agenda. Did you people notice that? Did you people notice the change in two students just in front of you as an example? Now, let me tell you what is the idea behind making a fixed introduction and agenda, all of you. Both of you are right. I do not want any fumbling in the introduction. Now, when you start your introduction, I want an introduction to an agenda to be fixed. Why? Because see, you are in one module for one cubicle, and you're leaving that cubicle going to the next. You would be thinking that, okay, now I have to change this because now this is oncology. And from that, you're moving next to the early pregnancy. You would be thinking, okay, now I'm in early pregnancy, I have to change my introduction and agenda. Here, fumbling comes in exam under nervousness. Under the stress of exam, you people tend to forget that, okay, here I don't have to speak. Harshiba, if it's an oncology module, you would avoid "nice to meet you." Am I right? Am I right? Yes, we heard. So again, in exam, what would happen is that you would be thinking, okay, here I can say "nice to see you," or in the next I have to leave this, and then you have a fumbling in the introduction.
So in this place, we can just add the sentence, "How are you doing?" That is also one sentence too.
Nothing. That's not required even. In few sentences, Sarvat, you would say, in few cubicles, you would say, "How are you doing today?" In the next, you will not do because she will say that, of course, I'm not good today, doctor.
Yeah.
Right? So idea is we have to pass this exam in a smooth manner. We don't have to fumble. The idea is we have to make one introduction and agenda which fits to all sorts of stations. And we don't have to decide for ourselves, here I have to speak this, next I have to leave this, and in the third, I have to then decide my words again. No matter how good the command you have in English language, I didn't have any problem in the communication myself when I was preparing. Even then, I had fixed my lines, that I don't have to work in different cubicles, that today in this, I'm going to speak this, in the other, I'm going to speak this. Like few of my students, they were in habit of saying good morning, good evening. I am Dr. Sarvat. I have no problem with good morning and good evening, but the idea is that in oncology or the BBN, it's nothing good. So you avoid good morning, you avoid these cheerful things. So why not to make hello and hi so that it suits every station? Do you people get my point? No problem with good morning or good evening. But the idea behind is that in few stations with good morning and good evening might not work. So why not to make safe lines so that we practice from today so that it comes out spontaneously. Now this is about "nice to meet you," right? I would like to take it out from your introductions. Second thing, Sarvat, when you said that I'm going to examine you and I might have to run few tests, this you made part of your agenda. So this can be an agenda in few of the stations, but it might not be agenda in others, right? So why not to fix an agenda? So, you know, to make things easy. You will be thinking you might say this line because you're practicing like this in few stations where examination or the investigations are not to be sent. Do you get my point? But in exam, it would be happening. Why? Because you had this practice at the back of your mind, right? So let's start. Please write it down. Yes, Atya. What you have to start is that in the beginning, start from hello or hi, okay? Rather than good morning or good evening. This is number one. So hi, I'm Dr. Sarvat. I'm one of the doctors in the gynae clinic today. May I confirm your name and age, please? Write it down, everyone. It has to be like this. Now you can speak up two things for the confirmation of the name and the addressing. Is it okay I call you Sam? How may I address you? Whatever you're comfortable with, but today fix it. I do not want in one station you speak in one manner and the other you start fumbling, right? I'm going to say that again, please. Everyone write it down. Hello, I'm Dr. Sarwat. I'm one of the doctors in the gynecology clinic today. So may I confirm your name and age, please? Is it okay I call you Sam? Or if you're comfortable with, how may I address you? This is going to be your introduction. Now, agenda would be very straightforward and simple. If some symptoms are given to you, I have gathered from your case notes. Write it down. I have gathered from your case notes, oblique. I have gathered from your GP letter, oblique. I have gathered from your midwife letter, oblique. I've gathered from your SARC letter, anything which has been provided to you. If no letter is there, you simply say, I have gathered from your case notes that you're here because you have heavy periods. Is that correct? Surely, in the next few minutes, I will be discussing about your complaints, address all your concerns, and together we will come to a safe and acceptable and a mutually agreed plan, Sam. How does it sound to you?
Dr. Sidra, can you repeat that again?
Sure, Divya. I have gathered from your case notes, oblique, whatsoever is given to you, that you're here with dash, with heavy periods, with painful sex, anything which is given there, right? I have gathered from your case notes that you have problem with your periods and you're here to discuss about this. Am I right? Surely in the next few minutes, I will be discussing about your complaints, comma, address your concerns, and formulate a management plan. Right? Now you have to seek permission for the information gathering. Please omit this line because I'm seeing you for the first time. Why am I against this line? Because at times it's a follow-up as well. Then you speak this, it becomes awkward, right? So you have to say, so can I ask few questions to know more about you? Right? Can I ask few questions to know more about you? And then together we can come to a safe and acceptable and a mutually agreed plan. How does it sound to you, Sam? Am I clear about introduction and agenda? In this agenda, you can fix this agenda in any of the station. And even...
Sidra, please, can you repeat this one?
Sure, Dr. Sabia. Just in few hours, recording would be uploaded on your Gmails as well, okay? Just for your...
Okay, that's okay then. That's okay.
No,
then.
I'm going to repeat that, Dr. Sabia. That's not an issue, but all the recordings are going to be with you. It's on recording, and after 2 hours, I'm going to share the recording on your Gmails, okay? And that's going to stay with you till exam. That's not a problem, okay?
Thanks.
So, hello, I'm Dr. Sarwat. I'm one of the doctors in the gynecology clinic today. So, may I confirm your name and age, please? Is it okay I call you Sam? Yeah, Sam, I have gathered from your case notes that you're here because you have heavy periods. Is that right? Yeah, surely in the next few minutes, I will be discussing about your complaints. I will address all your concerns, and together we can come to a safe and acceptable and a mutually agreed plan. Can I ask a few questions to know more about you? Am I clear? This confident start I want from every student of mine. And this agenda, you can use this introduction, you can use in any station, no matter it's a sad station, no matter it's a cheerful station. Just change the clinic. I don't want you to fumble in the clinic. Clinic is written outside the cubicle. Just change the clinic and just change the name, of course, and the complaints of the patient for which she's here. That's it, right? You can use this and just cram it up so that, you move from the one cubicle to the other. You don't have to think. It comes out spontaneously. It comes out from your reflex. And now you come to the information gathering. Communication with the patient in the relatives domain. First question has to be an open question. Please write it down. I do not want a closed question from any one of you because it decreases the chances of knowing the station. Please give the role player an opportunity. I've got 2 reasons for that. Number 1, the role player has an instructions and she has been given a highlighted sheet. When I was in the college, they used to show us that this is the sheet which we have been provided and these are the highlighted lines which we have to tell to the candidate. If you don't give an opportunity, for example, I make my introduction agenda. Sam is having heavy periods, and I ask one question. So may I know, since when are you having a heavy period? She would be saying, maybe 6 months. Is it a closed question or an open question?
It's a closed question.
Yes. Sarvat, so what should I be asking? May I know more about your
May I know more
period, Sam?
about your situation?
Very good. Well done. So the first question has to be, may I know more about your condition? So let her come up with the story she has been provided with. Let her come up with those things which she has to basically tell you. And it gives you a breather as well, you know. When you enter into the cubicle, you make an introduction agenda, you take a breath there, and you're happy that, you know, your heartbeat is settling and the role player is telling the things. So please keep nodding at that time. Bend forward on the table at that time. Make encouraging sounds. Okay. Yeah. Right. Don't cross your arms at that time. Okay. This is what examiner is looking at you at this domain, communication with the patients and the relatives. So it starts from the introduction. Avoid fumbling. I'm going to see you guys that you should not fumble. Right. Communication with the patients and the relative keeps on going from the introduction. Then if it's a BPN, of course, you have to practice empathy. I will give you lines for that. Acknowledge her emotions. I can understand this, Sam. We are here to support you in this situation. Such lines, you have to mug it up. Okay? And angry patient handling, I will again tell you when we'll do the angry cases. Okay? When you come to the management, it is your applied clinical knowledge. But communication with the patient and the relatives, it's also being tested. How? That it's not that Dr. Sabia is perfect in her applied clinical knowledge, and without taking a single breath, she starts that, okay, I know in ectopic pregnancy, you have expectant management, medical and surgical. We do nothing in expectant, let the nature takes its course. And in the medical, what we do is that we give an injection to you and we'll follow up with the pregnancy hormone. In surgery, we'll see that if your blood pressure is falling or if your heart rate is rising, we are going to perform a surgical method in which we might remove one of the tube, or we might remove the pregnancy from the tube. Is this the correct way? No.
No, of course not.
No, but I know that you all know that this is the management because your applied clinical knowledge is good. But you might pass in applied clinical knowledge, but you might fail in the communication with the patient. Why? Because you all have to give information in chunks. Check her understanding rather than just, just spilling up all the information, and give opportunity to ask questions. So remember, my way of reaching the applied clinical knowledge in management is that I enumerated first that these are the management options. Then I explain about the first, check understanding. Explain about the second, are you with me? Am I clear so far? So these 2 or 3 questions I used to keep in my mind and just throw these questions after like 1 minute or so that it's not only you talking. It's a mutual talk. Examiner is looking at this. And then when you do a good closure, you give the information leaflet and support group, and you give a thank you smile to the patient, if it's not a BBN, of course. Then your communication with the patient and relatives, starting from the introduction till the closure, it gets passed. Am I clear? Yes, Atya, my suggestion would be don't include examination, few tests, and this. Why? Because it makes a big agenda. It takes your time. Other way around, you have to give in the closure. So why to do it twice, right? So it's better way to fix an agenda, because in one station you will do the examination, in other you might not have to examine. Then you'll think that I have to change my agenda. Do you get my point? So I'm against changing from one cubicle to the other. So it's better that you make an agenda so that you are confident that whatever I'm saying is correct. So let's move forward. After information gathering, if you have to do examination, you will come to that. But making an agenda with examination doesn't give you an extra score. It might deduct marks if it's not required. Do you get that, Dr. Athiya? Am I clear? Right? As stations may not finish in 10 minutes, so agenda, all points done. This is about teaching. In teaching, it happens. See, examination comes in midway. Examination, Dr. Athiya, comes in midway. It doesn't come at the end of the station. So if you have to examine, it would be in information gathering. Otherwise, you have to do that. So in making an agenda that I might need to examine you, that might not suit in all stations. So we should make it in one go so that it is easy for you that in all stations, I have to speak the same rather than fumbling. When you practice, I'll let you know that where this agenda is suitable. Okay, I'll let you know that where you can speak about this and where examination would be coming. All right, okay. Now, what are the pitfalls? Welcome, my dear. What are the pitfalls? The pitfalls is that what candidates do. candidates forget the introduction.
I'm
The
sorry,
entry into
one point, Dr. Sidra.
anytime, Dr. Sabia, please. Yes.
Dr. Sidra, you are talking about agenda. The mentors, many they are saying that fix the agenda and include everything, what you will do, you will give leaflet, you will refer this, say all this at the start with the agenda, so that if the station finishes, at least you have talked about that, all the things in the start.
This is
But you are
only in
saying that,
teaching, Dr. Sabia. This is only in teaching. See, examination comes at what point, Dr. Sabia? Examination comes in 3 to 4 minutes, right? But in 3 to 4 minutes, you might not examine in few cases. So in exam, what happens is that you mention it there. So it goes on, keep on going. You speak it there, and you don't have to examine this patient because examination has been done or the findings had been provided to you. So why not to fix it in a smooth manner? Of course, examination doesn't come in the last 1 minute. Yes, PIL does come in the last 1 minute, but examination doesn't come in the last 1 minute, right? So doing the examination prior in the agenda, we are not fighting in the last 1 minute for the examination. It comes just in 3 to 4 minutes time if you have to do that. All right. So once you start, yes.
Yeah, it means that according to you, if when we finish the information, like when we finish the history, then we can talk. Now I would like to examine you with your concern in the presence of chaperone. You think if we examine, if the station needs examination, then at the end of the history, we will ask the patient to examine her.
If examination is a requirement, so we'll say
Yes.
at that time after the history, yes. If it is a requirement, if it's not a requirement,
if it is a requirement,
of course we're going to leave that and move forward. So this is an easy way, rather than for every patient we make a fixed agenda that we might have to examine you and send you investigations, right?
Yeah, we are getting you actually.
Okay, thank you. Right, so the pitfall is that candidates forget introduction and explaining roles. They are in the gynae clinic, they speak that I am in the fertility clinic, subfertility clinic. This happens. Why? Because from one cubicle to the other, there is a little fumbling, and they cannot take the previous station's points back from their mind. So this is what you don't have to do. You don't have to feel awkward and embarrassed about the lifestyle questions at all. This is very common. So please don't fumble in asking those questions, or don't feel shy in that, okay? Now, telling patients what they need rather than negotiating a plan, right? Please don't dictate the patient with one option which she requires. You have to offer other options as well. Not listening to the patient at times when she's trying to tell you that I want a herbal medicine and you don't like herbal, so you say outrightly no. This is again against the communication with the patients and the relative. Using jargons is not acceptable. I would make you practice in a manner that you people read the patient information leaflets, and of course you know what words and what terms you have to use. Similarly, avoid abbreviations. So all these points, a big no to all these. We have to overcome these pitfalls and make it a success in the communication with the patient and the relatives. So we have to practice with the buddies, okay? We have to practice in chunking and breaking up information. We have to rehearse asking difficult questions like the sexual history. That's important. And we are having this first session on the sexual history. I'll train you on this, that how we have to ask a sexual history in a decent manner, in an empathetic manner, and in a sensitive approach as well, so that it doesn't seem to be non-judgmental. Practice negotiating skills, and you all have to make your layman terminology dictionary, right? Layman terminology dictionary, we are going to make from today so that we have an ample amount of words and we don't fumble between the jargons and the layman. Whenever you read some sort of leaflet, please, at the back of your notebook, start writing those words. Make a column. So here you write the adhesions, you say scar of the previous surgery, right? So basically you have to write all of your terminologies parallel, so there's no problem in that. Now, communication with the colleagues. Communication with the colleagues is the easiest domain, I always tell my students, but what happens is that communication with the colleagues, they do not touch the joint team care. They don't call the senior obstetrician. They don't involve a specialized midwife, the baby doctor, the anesthesia doctor, the blood doctor, or the concerned medical specialist. And they tend to
fail the station. Why do I call it the easiest domain, friends? Because this domain is the only domain which is passed in 5 seconds. I mean that. Information gathering, to pass information gathering, you take 3.5 to 4 minutes. Communication with the patient, you take entire 10 minutes to pass that domain. Applied clinical knowledge, you again take around 2 to 3 minutes for the management plan and you pass that domain. This is the only domain which is passed in 5 to 10 seconds. Do you people agree? Do you people agree with me? That this domain is passed in 5 to 10 seconds, but the problem is that you people totally forget to involve the colleagues and fail this domain, which is basically unfortunate for ourselves. The easiest way we are not thinking about. Generally, what happens is that you people are senior obstetricians and gynecologists at your places. So you start taking decisions by yourself, right? So you need to remember that you're an ST5. In communication with the colleagues, there's a beautiful system of a handover communication. We call it as SBAR, situation, background, assessment, and recommendation. You people miss that in communication. In structured discussion, I will tell you that how do we use this tool? I will tell you that how do we make situation, background, assessment, and recommendations. Generally, there's a struggling to convey and clear the summaries to the communication, especially it happens in a structured discussion. When the examiner, you have to communicate that this case has happened in an SBAR manner, you people start fumbling that what do we have to tell, where we have to put a full stop, where we have to continue. This problem we have to solve in our practice, that we have to be very good in SBAR tool, because 1 or 2 stations, they require this communication of handing over between the colleagues. 1 or 2 stations can be about the problems with the writing as well, right? You have to give a prescription. It came in college few times, never came in exam, or you have to fill a consent form. So I'll tell you that how you have to work over this. However, do not forget the MDT requirement. We have to work on these pitfalls. No such mistake has to be done, because we have to pass in communication with the colleagues. We have to practice writing summaries. We have to practice like discharge summaries or the consent forms. We'll do that in the specific domains. You should be knowing the role of the nurses and the midwives. I'll give you a special chart on that when we'll do the labor module specifically. I'll give you all the details of that who is going to perform what duty, right? And of course, you have to do a good teaching session with your buddies as well, because that communication with the colleagues should not be, again, superiority should not be there when you're teaching a colleague. The first thing you all need to remember is that you are not senior obstetricians that you're practicing at your place. So if it's a postpartum hemorrhage, if it's an emergency, please do not hesitate to call your consultant obstetrician. Do not hesitate to involve the joint team of doctors, the MDTY, because you're an ST5, don't forget that, okay? So if you're going to remember these things, communication with the colleague is the easiest domain to pass. Unfortunately, friends, patient safety is the domain which is a problem. If you see my students who have joined me who are having a repeat attempt, patient safety. Pallavi has a question, hold on guys. After information gathering, are we supposed to summarize case in all stations? Pallavi, my way of summary was that I never used to repeat all the positives, because it starts taking your time. What I used to do after summary was, after information gathering was, that Sam, thank you for providing me with this information. Would you like to add anything in this? Right? This was my way, that's it. I never used to repeat all information. Why? Because it takes another 1 minute, Pallavi. But yes, there are chances that you are missing out at something which is going to affect your management. So simple, 1 line. Thank you for providing me with this information. Would you like to add on something in this? Got it, Pallavi? So this is like 5 seconds if she wants to add on something. You thank her for information gathering and you ask her, rather than telling, so what I've gathered from your history is that you have got problem with your periods for the last 6 months and you have taken this as medicine, and then you say anything you would like to add on. You get my point, Pallavi? Right? All of you got that? That how we are going to give an opportunity to the role player to add on information gathering if at all you have missed something? Yeah, all of you have got that? Okay, So please don't summarize it back again because it takes another 1 minute. But yes, you can ask her that if she wants to add into this information, anything you have left, okay? Got it? Okay. Now coming to the patient safety. Starting from the information gathering, the allergy. Now, patient safety points are in information gathering. Patient safety points are in your management making, right? So side-wise, it goes in your template. When you ask about the allergy and you don't document that, you fail your patient safety. Asking an allergy is not a patient safety. Document that in the notes and you pass your safety. Examination in the presence of a chaperone is a patient safety. Calling for help is a patient safety. Decision making is a patient safety, right? What suits the patient best? Confidentiality is a patient safety. For less than 16 years or for adults who are having the problem with the mental capacity, assessing them is a patient safety. Informed consent in the surgical module or the post-op module is a patient safety. Respecting the autonomy, like in Jehovah's Witness we were talking about, is patient safety. Safeguarding, risk management, incident report. Prescribing safe medicines in obstetrics, which should be baby-friendly, non-teratogenic, right? This is all patient safety. Correct contraception in gynae and triage. So if patient says, I'm allergic to nickel, so we need to utter that I will document in notes, you mean, right? Dr. Athiya, if you're talking about only the contraception, then you're going to check for this. Otherwise, for nickel, only we are concerned with the metals because of copper, that's it. If she says, I'm allergic to penicillin, you say, I'm going to document that in your notes. For example, if you are doing a station and I say, you say that, do you have any known allergy? I say that, yes, I'm allergic to penicillin, doctor. And you move to the next question. Then you're failing patient safety. If you say, yeah, thank you for informing me, I will document that in your notes. And you move to the next question. That's it. You're passing your patient safety. Documenting the allergy is patient safety. Asking the patient's allergy is not a patient safety. Basically, anybody else can be handling that patient, right? So if you are taking history, you have to document in the notes. You get that, Dr. Athiya? You get that? Okay, thank you, right. So this patient safety, as I told you, that the pitfalls are that you don't understand the incident report, which has to be sent. Clinical governance is missing at times. The audits, you don't understand at times, which you're going to work upon. Duty of condole, apologizing. Don't be shy in apologizing and accepting the mistake. If in surgical module specifically it has happened. So we all have to work on these pitfalls specifically for the patient safety, and we have to make it a success. We have to learn the proper consent. We have to learn the phrasers. We should be knowing the right drugs to be given according to the station. And we should be knowing the right doses. If we are prescribing something, we should be knowing that less than 16, we need to check for the Fraser or the Gillick for the termination of pregnancy. All these things would help you. We should be knowing that in the surgical module, checklist has to be followed. I will give you my buzzwords for passing the surgical module, that what 3 words make you pass that module, right? I will tell you about in the audit, what are the buzzwords which you have to speak and you pass the station, when we'll come to that individually, right? Again, safeguarding principles you should be knowing for specifically for the sexual module, which we are just going to touch in the next session. Now, the domain which is left is that applied clinical knowledge. I know you all are very good in this applied clinical knowledge because, of course, after part 2, if there's not a very much gap, you all are practicing. So we know the recommendations, the prenatal guidelines, the NICE, and the obstetric and gynecological articles as well, right? But I have a concern here. The concern I have is that in part 3, don't make a mistake of reading GTG as in part 2 for the entire day. You just need to give 30 minutes to revise your recommendations, or if at all you've got your notes for the part 2, right, Divya? Right, I used to make your notes for the part 2, remember? So you can simply open up those notes and revise your recommendations so that you're fresh with your recommendations. Please don't give the entire day to GTGs because it doesn't come in 10 minutes. You just have to learn that what I have to speak about the applied clinical knowledge. That's it. For example, if it's an ectopic pregnancy, you don't need to read the entire GTG. What you need to read is that, okay, what is the criteria for expectant medical and surgical, so that your applied clinical knowledge doesn't go fail in that part. Okay.
Sidra,
yes,
yeah, Dr. Sidra, can I ask some?
Please, please.
Yeah, the GTG, the going through the only the board lines and the algorithm will do, or
Yes.
that is okay?
Sufficient, Bindu. Sufficient. Because
Okay.
the idea is that you should be knowing that what is applied clinical knowledge. GTG has many other things as well. You don't need to go into that. But yes, only
Also, do we have to remember those numbers?
numbers in the PIL, they're sufficient, but only important ones, not those which are, when I come to the stations, I'll tell you, because what happens is no matter how good you memorize them, under the stress, you tend to, make a little up and down. So always remember, if you forget some number, it's better not to speak rather than speaking up the wrong number, because that can make you fail. But if you're skipping up speaking that might make you pass, because it's not something which is like, every student would be doing. But if you're giving a wrong percentage, of course, then it puts you in difficulty. Okay, so do only major percentages. When we'll be doing each station, you can ask me, Sidra, do we need to remember this or can we skip this? So I'll be guiding you there that yes, it is important. So please memorize that. If it won't be important, I can tell you that, okay, skip this. You don't require that. Okay. Now you're welcome, Bindu. So remember that in applied clinical knowledge, please justify the plan. For example, what is the first line management for HMB, heavy menstrual bleed, according to the NICE?
Mirena coil.
Mirena coil, Dr. Sabia, yes. So Mirena coil is the first line. Now, Dr. Sabia, I'm your role player and I say that I want a pregnancy in 1 year time, or I say I want a pregnancy just in 4 or 5 months time, and yes, I have heavy menstrual bleed. Would you go for Mirena coil?
No, definitely no.
Very good.
I will give her, yeah.
What will you give her? Tranexamic acid or mefenamic acid, right? Non-hormonal.
Mefenamic acid.
Very good. Very good. Yes, Jyoti, well done. Why is that so? What I want to tell you is that it's, yes, NICE does say that IUS has to be there, but you have to individualize your patient in exam. According to the age, according to the parity, maybe her culture and beliefs, she's not accepting anything. So please justify your plan. Here, you don't have to fail. Now, she wants kids in 3 months' time, and you do IUS for her because you think that, and I say so, no matter it is first line, but it doesn't suit her, you would be failing your applied clinical knowledge. This is what I want to give you an idea. Okay, so in exam, you have to alter your management plan according to the requirement of the patient. We cannot force them to have something. Yes, we can offer them all the plans with the pros and cons. This is the gist, okay? Now, why do we fail in applied clinical knowledge is having patchy knowledge. You are not sure about the recommendations, and you have a scattered gun approach. What is that? That you are not confident in your management plan. I will be making the algorithms for all of you in the management plan. Step number 1, step number 2, step number 3. So that you're sure that where we are going, and we are going in a systematic manner rather than a scattered gun. We are touching the expectant, then we are coming to the surgical, then we are going to the conservative, then we are coming to the medical. This is known as a scattergun approach, that you're not systematic in your management plan. This comes with your making template. I'm going to tell you that how you have to make a perfect idea that your applied clinical knowledge should be just done in 2.5 minutes, and that too, touching the first, checking understanding, coming to the second, checking understanding, coming to the third, checking understanding, and ask her concern. What does she feel best for her? This is the perfect way of applied clinical knowledge. With practice, it would be superb. It would be coming as a flow to all of you. Don't make a mistake of not listening to the patient's wish, please, because they always do in 1 or 2 stations, that the patient is having some concern behind not taking something like copper coil. She has a concern. She's not happy with something inserting inside the womb. And you keep on telling about the pros of the copper coil because you think it's better for her. She's giving you a hint. Try to follow the role player. Okay? Friends, there's a fine line of leading the role player in the station so that your time doesn't get wasted, and at the same time, following the role player because she's leading you towards the scorecard. If you understand this in practice, there is no point that part 3 gets failed. And I'm going to train you with this practice, that how, as a role player, I'm leading you, and how, as a candidate, you are leading me so that the 10 minutes time doesn't get wasted. Okay, you need to learn this thing and we are going to work upon this thing. So no pitfalls in the applied clinical knowledge, please. Therefore, we have to ensure that we know the relevant guideline recommendations. We know what are her individual care plans. We are not going to send unnecessary investigations that to make you fail your applied clinical knowledge. For example, if it's an HMB patient as we are taking, and I say that I'm going to run few investigations and I send serum ferritin, is my applied clinical knowledge correct? Do I need to send serum ferritin in HMB patient?
No.
Unnecessary investigations, if you're sending, again, you are failing your applied clinical knowledge. So send what is required, right? And keep your patient as a center to ensure that applied clinical knowledge is for her and not for the GTG, right? In structured discussion, it's absolutely right because you're discussing about the guideline, that's fine. But when you have a patient, always address her concerns, what is her requirement, tell her all the management options, offer her all, and then it is her decision to suit what is best for her. Okay? Now, any questions from the domain before I move to the self-assessment, please? Any questions, all my friends? If anybody is still unclear about the domains, Dalia, Devya, Doa, did you understand the domains, my dear? All the 5 domains, what it contains, how we are going to make it a pass domain? Any questions, my dear? Did you people understand how we are going to introduce and make an agenda? Liana, Midhat, Salma.
What is this review evidence levels for guidelines? We have to memorize it.
No, you don't have to memorize it. It's only that don't do the recommendations of the previous, right? Right? Okay. So we'll do the recent ones. So that in exam we are sure. For example, it's a cervical screening. So if they ask now, of course, it's going to be HPV as a triad and not the smear. So this is what they mean, right? Okay. Right. Salma, you joined late, my dear. I'll just be sharing the recording, okay? Right? Any questions, please? Are you all clear about the domains, my dear? Clear? That's perfect. Thank you very much. Now coming to the requirement, what my requirement is from all of you. See, I'm a different sort of a person in terms that if I hold hands, I mean that I need an output as well, okay? There are 2 things I want to talk to you prior to this. One thing is that, see, I did this exam. In fact, all my exams, I know that this is a doable exam, but I don't want all of you to go in the wrong direction. I never spoke openly in any of the forum because I knew my strengths, but I listened to all. I have to be very honest with all of you, okay? I listened to all. Why, Rehma? Because if my strengths are there and I'm going to practice on an open forum, there are people who are going to copy me because these are my strengths. At the same time, I used to listen to everyone on the open forum to catch up the points which I think are important I'm missing out, to leave those points which I think they are doing wrong and tell myself, okay, I'm good in this, I'm better in this. Why? Because this is a competitive exam. This is my first suggestion to all of you, please. If you are doing something here and if you are sharing it with somebody, you're losing your chance to pass this exam. This is my first suggestion. I want honesty in return. Why? Because if I am going to give my 100%, I will not keep any barrier in teaching you guys or making you just come to the level that you people have to pass this exam. I will not leave any difference in that. This is my way of doing that. I can keep a gap. I can keep things, hidden as well. That, okay, so this should not be taught. Okay, so I'm not going to do this in this way. Many of the Telegram groups are being run by my students and they owe that to me and still they have difficulties. They message me that, okay, guide us for this because our students are having this problem, and I give them a voice note. I do that, right? But at the same time, they have passed the exam, so they're in a better position. For you guys, you are going to make this happen, right? You are going to strive with this. Don't harm yourself. Don't harm yourself by making the things open. And as it is a competitive exam, if everybody is going to do the same, of course, you will be in difficulty. Did you people get my point? Rema, Dipti, Bindu? Bidhat, did you get my point that where you need to have a focused preparation, where you need to understand this thing that you have to be better than others because it's a circuit. It's a competitive exam, right? Strengths of yours, we need to polish that. We need to polish these strengths and we have to work on our weaknesses because nobody is perfect. Only Rahma has understood that. Anybody else has not understood that? Bindu has understood that. Dipti has understood that. I need a thumbs up from all of you to understand this thing.
No, I understand, but I send message to wrong. I did not you understand, Dr. Sidra.
You understood. You sent message to someone else, yeah?
Yeah, only one person I sent this message.
Okay, yes.
Maybe got your point, Dr. Sidra.
This is very important.
I think we all are mature enough.
Yeah, this is very important. So my first requirement is that nothing from this should be shared to anybody because you have paid. You're giving your financial, you're giving your physical. I'm going to screw you for your emotional, everything. I'm going to hold your hands. I just had a station with one of the girls who didn't present yesterday well. I called her and said that 10 minutes give me because I'm not happy with the presentation. Why graph is going down? But see, this is my responsibility. In return, if I'm not going to get 100% from you guys, again, I'm going to push you guys to do that, but I need to make you guys pass. This is the responsibility, right? The responsibility is that we have to pass this exam and do not let our families suffer more, right? This is the most important thing. Yeah, okay, Liana, no problem. I will share the recording, my dear. All right. So what you all have to do is, see, I take multiple courses in different forums as well. I take mid-exam as well, right? But of course, that's not my one-to-one coaching. So I have my 3 or 4 modules there. I do take that, but there are other mentors as well who have to take a responsibility. Here, I have to ensure this is going to be, I am going to give you everything as in a platter. But my requirement in return is that you people just get fixed to that and you people understand that you have to pass this exam for your sake. Of course, it's going to be my result, but your first person who is going to be affected by the result is going to be you, your family. So we need to understand this thing and we need to work over this thing. And today, what you all are going to do before sleeping is that I'm going to, thank you very much, Sarvat. I'm grateful for that, sweetheart. Today, you all are going to send me a message. It is the 4th of July. You're going to send me a message today on private WhatsApp because I have to maintain my document and notebook for all of you. Your strengths, what you think they are. Your weaknesses, what you think they are. And in this preparation, do you have any special concerns? Like few students, they tell me that they have a concern regarding the time management or any concern you have regarding some family commitments, domestic issues or COVID duties, anything it can be, my dear, because I have to analyze myself as well. This is, you all have to do today, right? Today, so that I complete my homework and I have to complete my notebook for that. 4th of August, we are going to review with the same messages again. And we'll see in 1 month's time, are we any better? In the strengths, they have improved. The weaknesses, they have been polished a little. The concerns, they have been addressed or not. Again, we are going to do that on 4th of September, year 2020 as well. And I mean that, okay? I need to keep a note of that so that I can work individually because everybody is different. Everybody has a different baseline as well, right? I would be waiting for the messages, please, so that we can work upon this and I have my one-to-one connection with all of you separately. If somebody would be lacking behind, I would be there to pull you guys up and give you the encouragement from others as well. And as a group, as a family, we have to make it happen. All right, so I would be waiting for these strengths, weaknesses, and any special concerns you have during your preparation. Again, after 1 month, we all would review that is graph rising up. Yes, Divya, I'm all there to guide this. Okay, right. So this is what we are going to do. Yes, Dr.
Yeah, the strength and weaknesses during preparation will be understanding better, I feel.
I understand.
Yeah.
I understand, but still, you know, somebody has like, for instance, I'll tell you that, yeah, Divya, I'll do that, sweetheart. I'll do that, my dear. A few of the students, they would be writing that, okay, I'm good in communication, I know. You know, like Bindu, if you're practicing, I know you can write that my strength is that I'm better in applied clinical knowledge because I'm current, I'm working, you know. So these sorts of strengths, please have confidence on your strengths as well. People who say that I do not have any strength, I always write them back. I need to know what you think is your strength. The first thing in life to be successful is that please analyze yourself and be confident upon those things which you can do well, right?
Thank you.
So this is all we have to learn, and we have to be confident over that, right? Yes, Dr. Ati, I'll just be sharing recording, my dear, just in few hours. I'll be sharing on your Gmail. Outside the cubicle, in 1 minute, you have to write down, read the station, okay? And 1 minute, make a plan. The plan is simple. When your introduction, agenda, till information gathering is all settled, why to fumble? We don't have to fumble when everything is settled. When we know that how we have to enter into the cubicle, right? Okay, all right. So coming to this point, that the sequence of case presentation. So you all know your names who are going to present in the first live session. Even who is not presenting, I would like you to make keys so we will be interactive in that so that we learn from all the stations. Now, thank you very much, Pallavi. I'll provide with all of you all those energies. Yes, Divya. And we are going to make it happen. Nobody is going to sleep during this preparation. We all are going to make it success attempt, and we are going to celebrate it together. Okay. Now, what I'm going to do is that for the first session, I'll put all the stations which I'm going to make for all of you. That's number one. Number two, I will be now posting all the reading materials regarding that. In specific mini groups, what you have to do. In mini groups, what you have to do is that you have to divide the stations. Salma, are you here? Dalia, Midhat, all of you are listening to me, right? So what you have to do is that there are 8 stations, for example, or 7 stations, for example. So all of you can take like 1 station, and then again, another 1. So the station gets completed in the mini group. When you people decide the meeting up time, for example, Divya says that I want to do emergency contraception and 1 more station she can take. Tomorrow, the group D decides the time that this time we are going to meet up. 1 would be the role player and Divya would present the station. Before that, Divya, your template should be ready. The written template of emergency contraception should be ready for this, right? During preparation, if you people are having difficulty in making the template, you can ask me that we are having difficulty in this, from where to make that. I'm going to provide you with the details. I'm going to send the voice notes in the mini groups wherever in preparation you're having difficulty. Now, Divya's emergency contraception is ready. She has presented that day. She understood and she got the feedback from others that here she's a little lacking, right? She's going to adjust that. Now, when I will do in the main session, I will give all the solved template. Now, Divya doesn't have to write all complete from there, only those points which were missing, and organize that finally according to the way I have told in the main session. In this manner, all your 100-150 stations, you'll have written templates with all of you. Only in last 1.5-2 months, you just have to speak and communicate. That's it. The effort you're going to do today, it is going to pay off in the last 1.5-2 months. And students who fail in the last months are those basically who do not understand. At the last 1 month, they have pencil and pens in their hand and they're opening up lots of sources and they're writing their things. That is the time to practice. That is the time to practice. It's not the time where you have to write the things. So we have to prepare ourselves that 1.5-2 months before exam, we have everything ready. We just have to revise the things and communicate those things. That's it, right? My requirement from all of you is that make 1 hour meeting time in your mini groups. Everyone should be presenting. You can do 2 stations a day as well. If you're comfortable, 30 minutes each, right? You can do 1 station as well if you people are committed, but my requirement is at least meeting up for 30 minutes to 1 hour daily so that you are in habit of speaking again and again. Whenever in the mini group you people are stuck up at something, you people think that you're not sure of this thing, just tag me there, send me a voice note. I'm going to reply the lines in the form of a voice note to all of you. But these topics should be going great. Yes, Bindu, did you get that? Or should I repeat that again, Bindu?
Yeah, can you come again? Because I think my net was a little bit unstable. Sorry, I'm extremely sorry.
No problem, my dear. What you have to do is that every individual, whosoever you're getting, Divya is taking emergency contraception, for example, in group D. She will be making the template. If she wants my guidance or she's stuck up at somewhere to see, I'm going to guide her there, right? And if you people can make it like it's an easy thing, or you can make it yourself, you're going to formulate that, and the Divya is going to present as the decided day. The group leaders would have that, okay, this day we are going to present this, this, this. So everything should be done at least one day before the session. Till Wednesday, all your topics should be done. Thursday is going to be the revision day, so that for Friday you are ready for the presentation. Okay? Thursday, everything should be ready so that you make a schedule. Group leaders make a schedule so that you all divide the topics and make your templates, right? Now, when I'll take the live session, I'll give you the solved stations. I'll solve them on PPT, making algorithms and all. So you'll open up your templates, right? And you'll add on the things, highlight the things, and make it final, so that before exam, you just have to revise that because it's done. All the domains are clearly mentioned there. Everything is done there, starting from the introduction till the end. The idea behind this, that Divya would be doing emergency contraception only, right? So you would be doing maybe assault. Okay, so idea is that one would be preparing one, and she'll be getting the template of the others as well. And in the end, I will be giving final templates for everything. And even if you in the mini group, you want some assistance, I'll be giving you there in the previous 1 week as well, to give you an idea that how you have to make this. Did you all understand this? This is going to be an ideal way of getting everything in just 2.5 months, and all your templates would be ready. We will have a book. Exactly, Divya. Everything should be in the form of ready with you in the form of sheets, so that everything you just need to practice. Now, few of my students, they make a mistake. They don't write it up, and they just, do the station at that time, and they learn it at that time. After 1 or 2 months, we are humans, right? We tend to forget the things. They don't have anything written, so they tend to forget the points. Revision is must. So you should have a written template of yours so that you can come back to that and revise that whensoever it's required, right? And the second revision would be very easy. It would be just in 15-20 days, and all your templates would be getting revised in quickly in your mini groups. Did you all get the idea?
Yeah, Sidra, so our templates will be ready, and
then we'll finalize it with the live session.
Yeah, then we can mark it with a different color or something like that.
Exactly. And you'll add on the points or lines, which I will add in the final session, which I'll not be satisfied with the presentation. So you'll finalize it after the session. After the session is done, like Friday is the session, what students they do is they take Saturday or the next 1 day for listening to the recording and finalizing their templates. And from Sunday, they'll start the next module. Did you people get that?
Yeah, thank you.
Okay, very good. Well done. In the books also, whatever are left. Yes, we can do that, Harshaba. We'll do that. Okay, right?
Hi, Dr. Sidra.
Yes, okay, you can do that. Yes, my dear. Yes, Jyoti.
Yeah, I just wanted to know, so this is basically our template, which each one of us will do to the topic assigned to us, and then you correct it when you do the live session. Just to
you are going to correct it. You are going to correct it after I give it in the live session. You can see maybe it doesn't need any correction. Maybe it does need correction, right? So you're going to add the points in there, and you'll make it organized a final one just in 1 day after the session, so that it gets ready. Right.
Yeah, so in the mini groups, not each one of us does all the templates. It is divided amongst us.
It is, yes, it should be divided. That's the idea. You will get from Girija. It's not that Girija will do that. Girija will give her, she'll share her template, and you'll be getting that, right? So you'll not be writing everything. So at least you'll be just making on points on that. You get my point?
So we write and we give it to the team leader, to Girija, and so Girija collects from everyone and shares with everyone.
Share in the mini group. Everybody will share in the mini group so that it is there for everyone, and in the end it is corrected 1 day after, so you get everything ready after the session.
Okay. Yeah.
Okay. Kadak, you're welcome, Jyoti. Right. So yes, Dr. Athiya, whenever you feel that you want some sort of assistance in any of the topic, I'm all available. Okay, I'm all available for that. Thank you. Now, another thing is that after this, few topics which are left, what I'm going to do is that I will be giving special tasks and the WhatsApp tasks. These WhatsApp tasks are going to be, I will put the Microsoft Word document there that these stations you have to do with the names. And after the live session, I'll give the tasks which are assigned to these so that I can listen to them as well. You can send the voice note. I'll give the feedback in the main group. So everything. Midhat, do the written as well. If you can do audio, that's fine. but do written for sure. Why? Because everybody should be getting that, you know, in your mini group. You get that, Midhat? Audio is good as well, so that, you know, you have that thing, but written, why it is better? So that, Midhat, in your mini group, everybody has this for the future reference, so that you can correct it together. Got that, Midhat? My few group members, they do audios as well. They share the recordings with the station so that they can go back to this. Even my previous ones, they do that. So it's on your ease. You can make Skype calls for the meeting. You can keep Zoom meetings. Few of my students, they do WhatsApp calls. So whatever is easy for you to meet up, that's not an issue. But you should make that. I'll give you some samples for that as well, okay? I'll give you the samples how they had been doing that, okay? And we'll share all the topics details as well, what are the resources to prepare the topics. All right. Now then we'll have the WhatsApp task, the stations which would be left. I'll give to these students. They're going to record that with their buddy in the mini group, and they're going to post in the main group so that I can give the stations. So for each session, we are going to have multiple presentations, few in the live and few in the special tasks, so that, yes, Ramya, I will do that, my dear, so that you all get the perfect idea that how you have to prepare this. Few of my students, Ramya, they're comfortable in writing. They make their writing templates and they get it checked by me. Few of the students, they're comfortable in Word documents. They've shared their Word documents. I will share that in the mini group so that you people get the idea, okay? But my only requirement is that we have got hundreds and hundreds Telegram. Anything during the course that should stay with you, because that is for you to get prepared. Can I get this? Can I get this security from all of you that nothing would be shared outside the group so that I can give you 100% in your preparation? Yeah. Yes, Pallavi, you've raised your hand, sweetheart. Yes, please. Yes, Athiya, I understand that. Few people still have that. Girija, hi Girija, you're silent today. Girija, I hope daughter is not making you.
Yeah, I'm listening. I'm listening.
No messages in the group, huh?
Yeah, I'm typing in between, not
okay,
talking.
Okay, fine, right. That's good to know. So everything has to be with you guys. Why? Because you have to pass this exam, right? So don't share anywhere else so that you all have a good level of, many of you are buddies, I know. So it's good that you people have joined as buddies. So it's easy for you to take your hands in hands and move forward. Okay, right. So we had a question. I think there was a hand raising. Dipti, you had some question, or was it a mistake? Okay. Now, what we have to prepare for the next is sexual reproductive health. I'm going to give you the basic template today. And the next you're going to, for each module, I will give in the end of the session so that you have for the next 1 week, you have you have it earlier as well, okay? Now, starting with the sexual and reproductive health module, you need to remember a few things. That in this, signposting for sexual history is must. Okay, so introduction, signposting for sexual history, and ensure confidentiality, remember. How do you have to do that? You simply say that, and whatever we talk here today is between you and me. My few of the questions might sound a little intrusive and personal, but they're important for me to know to formulate a better management plan. Can I proceed with this? So whenever you take a sexual history, always give a signposting. Otherwise, patient is taken aback. Okay, you always give a signposting for this. So we will start with the introduction and agenda as we have confirmed this. One more thing which I would like to tell you about sexual module is, and about the agenda is, that we fixed the agenda. I made you understand that how you're going to make an agenda, but at times telling about the having problem in the sex, at times telling about the assault, that is a little difficult thing to make an agenda, right? So you all have to remember that at times, if you think that in an agenda, you should not speak up those lines because you've not done the rapport building. What you have to say is, you simply have to speak up this line. So, Anne, may I know what brought you here today? There are going to be certain stations in which I will guide you that don't pick it up. Don't pick the complaint up and make an agenda. So for that, you simply can say, Anne, may I know what brought you here today? So basically, let the role player come up with the complaint rather than you speak it up that you had a sexual assault this day back. Do you people get that? Do you people get that? That where you don't have to speak from this? Got that? So otherwise, you're going to make an agenda. For HMB, it's not an issue. For PMS, it's not an issue. But some sensitive issues, you're going to make it the other way around. Okay? Now, another thing which I want to repeat lines with Ramya. Okay. So it's not written somewhere. This time the lines might be a little changed, Ramya, but just note it down, okay? So, and few of my questions might sound a little personal and intrusive, but I need to know to formulate a better management plan. Can I proceed with this? Okay, I'll just share the recording, my dear. If you have missed up anything, you can just write it down, okay? Pallavi, got that? So these are the signposting before the sexual history. Okay, now if the complaints are the sexually transmitted disease, so you'll start with since when, amount, color, history of STD, any treatment taken so far, associated pain, after the sex if it's there, right? If it's a PID or some sort of discharge is there, you ask about the vaginal discharge with lower tummy pain and running fever, okay? If it's a contraception case, you're going to ask about the unprotected sexual intercourse if it's an emergency contraception, the menstrual cycle detail, and the partner history as well, specifically in the less than 16. Please do not forget Fraser and Gillick and partner's age and safe sex in less than 16. These are the buzzwords to pass the station. Do not miss out Fraser and Gillick. Do not miss out partner's age, and do not miss out the counseling about the condom use. These three things in the template you have to incorporate somewhere because that makes you pass the station. STD, PID, contraception, any can be the complaint out of these stations. If this would be your HOPI according to the complaint, please. So few questions about the complaint. Then you're going to come to the gynae, obstetric, medical, family, surgical, drug, personal. The same questions which I told you in the main template. Now, Sarvat or anybody else who has made it upside down and has memorized it in that manner, so it's fine. But somebody is to start can do it in this manner as well, okay?
Sidra, what to ask in partner history?
In the partner history, you simply ask, so may I know more about your partner? Was he a regular partner? It's about the phrases, right? Was he a regular partner or the casual one-off? Was it a consensual sex? May I know the age of your partner?
Okay. Yeah, thank you.
These three questions. Why? Because more than 4 years gap, you know you require safeguarding, right? Yeah. So these three questions about the partner history, you would ask about in the emergency contraception less than 16 years. Then you will complete your gynae, obstetric, medical, family, surgical, drugs, allergies, personal history in a go. The same questions. You'll come to the social and the mental history. You would come to examination. If you require to send swabs in certain case, you will send that. If you don't require, like in case of sterilization, it's not required. So it's fine if you don't need to send that, you can skip it up. Management would be according to the station, of course, but this is the general outline. In closure, you can see if she is in sort of acute PID, you need to admit that, or you can arrange a follow-up as well. And then you can give the patient information leaflets if you're sending her back, yes, Bindu, and you can arrange the follow-up after 1 week or whatsoever. So this varies according to the station, but this is a general outline of the sexual and reproductive health template. This first part should be perfect, and please give a very good, yes, give a very good empathetic tone and sensitive manner, non-judgmental way in sexual history. I would work that on Friday and see that how your tone is in the presentation of the sexual and health module, because there's a little change in tone when you're dealing with these sensitive issues. Okay, I'll guide you about that. Right, so do I have any questions? I'll just tell you about the group performance. How do I make for the previous groups? Yes, Dua. Dua, Dua, come again, sweetheart.
I'm talking about agenda.
Agenda, yes.
Give me an idea about the agenda. Unfortunately, I'm still confused about this point in the 2 minutes.
Can you all hear? Dua, your voice is not clear, sweetheart. There's little distortion, my dear.
We can't hear Dr. Sidra. There's a lot of disturbance.
Yes, yes. Dua, type it in the chat box. There's a little distortion in your microphone. Sweetheart, type it in the chat box. Yes, yes, Jyoti, I understand. Yeah. Dua, type it in the chat box. I'll answer your question, my dear. Dr. Athiya, you know the stations, right? You are doing for the live session? But what station you're getting out of those 7, you don't know that, okay? Right? This is what you'll come to know out of those 7 topics in the live session, right? So we are starting the live session from you, A1, huh? Right? So out of those stations, you don't know, but the topics, you know that these are the 7 topics, but out of those 7 topics, you don't know which you are going to get. So this is what I'm going to tell the same day when you'll see the screen. Got that? Dr.
The schedule you sent, Dr. Sidra, it means there will be 8 live session in every session.
7 and 8. It's corresponding according to the you know, topics available. I have divided these. So few have 8, few have 7, and then 4 to 5 is
like 3 to 4 hours of duration. The session.
Yes, sir. I'm afraid 4 hours would be there. Yes.
Yeah, no, because of our duties and everything, I'm just guessing.
Yes, my dear. Generally, you know, when I dictate everything and when I give the explanation, yes, it takes time, sweetheart. So I'll require at least 4.5 hours from all of you, please. Yeah. Okay. And I'll be sharing recording the same night. I do that after 4 to 5 hours of just conversion. That's it. Okay. Yes. So Dua says, agenda, please, can you give me idea how to prepare in 2 minutes? Outside the cubicle, Dua, I'll tell you. See, what do you have to do? You will have to read a station and note the name and the age and see what are the complaints she's here for, right? And once you've noted that, you just revise into yourself, okay, I'm in which clinic? I'm in antenatal clinic, I'm in gynae clinic. What is the name of the patient I'm going to meet? So you say, yes, hello, I'm Dr. Dua. I'm one of the doctors in the gynecology clinic today. So may I confirm your name and age? Is it okay I call you Sam? So Sam, I've gathered from your case notes. Now these lines are ready with you, Dua, right? These lines are ready with you. Only what you're going to see is the complaint. That's it. Right? Okay. So only you know the complaint and you put it in the agenda. Dua, did you attend from the beginning when I noted the line? Okay, I'll send you the few voice notes from this from inside your mini group. Okay, do me a favor, everyone. Introduction and agenda, everyone send a voice note in your mini group so that I can fix your introductions and agenda before we move to the session, so that I can omit few points and I can add few points if something's missing, right? Everyone. Okay, Dua, we'll do that in the mini group. Everyone please send a voice note for introduction and agenda so that I can finalize that. Take any station and send me the introduction and agenda so that I can finalize your introduction and agenda today so that we can practice it from this point onwards. Okay, so I'll give you a voice note there in response as well and correct you, my dear. Okay, right. Dr. Sabia, it does take a time. If you people are ready for this, I have lots to give the lines and all, so that's not a problem. Jyoti, what time Friday suits all of you? What time suits all of you for Friday? One session we are going to have on Friday, one session we are going to have on Saturday, right? So Fridays and Saturdays, it's going to be alternate, okay? 3 p.m. GMT? Everyone, 3 p.m. GMT is fine for all of you. Where is Khanda? Khanda is not here, Jyoti, right? Girija, 5 p.m. GMT? 2 p.m. Midday. Nice. Earlier is better. That's fine. So 2 p.m., 3 p.m. GMT is fine. 3 p.m. is the standard time which you people want, right? Right? I understand, Salma. Okay, so we can choose between 2 and 3 p.m. 3 p.m. so Friday is fine. Everyone? Okay, everyone relax. Tell me. 2 p.m. 1 hour earlier for Friday is okay for everyone?
I would prefer 2 p.m. but depends on the majority.
I understand.
Because I will need to leave home by 7:30, which means 8:30.
I understand. For few hours.
No, sorry, 7:30, which means 6:30.
Okay, I think
3 p.m. is better, but if somebody has really genuine problem,
so,
then
2 p.m. would be better, or earlier if it suits everyone.
Okay, so 2 p.m. GMT for Fridays we can, and for Saturdays as well, you can decide that. I understand Liana. I totally understand. Liana is in Malaysia, so it would be her. She will having the night sessions. I know. Okay, right. So is everybody all right?
If somebody has 2 p.m. will be
the earlier the better.
Okay, fine. So guys, let's be cooperative with each other. So we'll do 2 p.m. GMT for Friday. Okay, and for Saturday 2 p.m. is fine as well.
Yeah, even Saturday for 2 p.m. is okay.
Okay, so let's keep it then 2 p.m. GMT as a standard time. Yes, okay. Right. because Salma, a few of the Gulf students, they were having their holidays on Friday. So I had to keep a balance in Friday versus Saturday, actually, you know, that at least they can attend few live sessions and then Saturday, okay? So we'll take 2 p.m. GMT standard for Friday. One would be Friday and the next would be Saturday. We'll do alternates, okay? Right? So that nobody is getting affected. We have a midway of doing this. Now, you all have to, group leaders have to ensure that the group performance is really good, because daily I could keep my notebook for this. This is one of the sample of the previous batch, though they are currently running as well, but they have done like their 6-7 modules completed. So I keep a date. For example, this was their May group, how they had to do that. This 10 by 10 scoring for the batch A I gave, and I told them that yes, I was happy with the 10 days they wanted for the leftover topics from the modules, and they utilized daily. They had to meet up. The day you don't meet up, I have deduction in the marks. I do check that you people are giving input. I see that you people are active. For the batch B, I had my concerns on 10th of May and 11th of May, on 13th of May and 15th of May, again on 17th of May. So I did cut their score for this. For every week, this is the scoring. And I gave them this clue that every group member need to be present and work in cohesion, because I could see that 1 or 2 were hibernating and I was not happy with that, okay? Again, for group C, for the first batch of mine, I was happy with their practice, and they were giving their 100%. And in fact, even few days, they worked harder. One day before the session, they met for at least 2 hours to make each other perfect. So they were working in cohesion, and I was very happy with them. Again, batch D had some problems in 9th of May, so I did cut the score. And on 16th and 17th and 18th is. The idea is that I score all of you for each day, to tell you that I have to work for you, and I'll work more for that person who is working hard. This is my nature. This is my idea. The more you require, Sidra, more she would be available for you. But when I see that you are sleeping in the mini group, when I see that you people are not giving your 100% in the mini group, I get a little taken aback. Why? Because see, I'm giving you the right direction. I'll provide you with everything. Now practice is your domain. Practice you need to do to pass this, right? So this is one sample for all of you to tell you that if you're not perfect at some day, you need to do better, because the group which is going better, I see that, like, I'm happy currently with the group A as well, group D as well. I have few concerns with the B and C, but still they would be okay because a little adjustment was there for the timings. You need to divide your topics and meet up daily. Try to improve each other. Try to work in cohesion. And, you know, this has to be a successful attempt. This is the only attempt we are having. Just have this in your mind. That's it. If you're going to keep this in your mind, no matter whatsoever is the circumstances, you take out some 30 minutes or 1 hour to have your presentation. Am I clear about this idea? If I am putting an effort, and you'll see in every session that I work a sleepless night before coming to you guys, that's just because I want 200% in return from all of you as well. Would I get
Dr.
that?
Sadram?
Would I get that?
Dr. Sadram?
Yes,
Yes.
Thank you, Harshaba. Yes, Divya. Yeah.
Yes. So when you say that we meet up on this group, because I've been trying, you mean like a virtual call? Yes. Do we do stations together with all of us on the same?
Yeah.
We can't do that on WhatsApp, right? And
you can do that.
Like,
my Indian students, they do that in a WhatsApp call, or they do Skype as well, my dear, or they do Zoom. So it depends how you're comfortable.
Wow. So in Zoom we can
but
record.
What they do is, few of my students, what they do is, Divya, they do a Skype call and then they make a recording of that as well, because if one is even not present, she can listen to the recording, what was discussed in the mini group and what points were discussed, you know, and they're having, believe me, in 5-6 weeks, I can see a very marked change in all of their presentations, because they're correcting each other, you know. They are, yes, telling each other this point was missed. So it all rings in your ears when you're presenting. Okay.
Yeah, we also started on Zoom, Dr. Sidra.
That's very good, Dr. Sabir. Because Zoom can have also, you can have recording as well if somebody wants to go back. So if My point is that one person can have a commitment as well. But when you all would be eager to meet, believe me that one person will be putting off the commitments and try to join you guys. This happens. Believe me, this happens. And I've been seeing that for like since April. My first group started in April, one-to-one batch in mini groups. And now they are not ready to, they've finished up with their modules and they're not ready to leave this. They have started books in the mini group because they've got such good coordination under my supervision that they're happy with this, and they are starting their Oxford and they're starting their Tony because these stations are over or the module wise. So my point is that you all need to have a very good harmony. That's why I make group leaders, so that one person takes the lead, and with a harmony, they can like distribute the things and they can make an arrangement that what time suits them, and you have a meetup as well. So you can do that as Zoom as well. Zoom is best. You can do that. You can make your meeting there. The idea is that I'm going to see that how far improvement is there. This is my only requirement, is that you need to improve every single day. You're stuck up somewhere, just drop in a message. Just tell me that, Sidra, we are stuck up here. So I would be there. I would be sending voice notes. I would be calling you guys. Maybe a few of you I need to take individually. It does happen with me. But see, everyone is not equal. That's why I need your strengths, your weaknesses, your point of view today, so that I can work upon you individually. Okay? Right? All right. So any questions, please? Exactly. So just do the division, Harshipa, tomorrow. So from today, so that from tomorrow, you can divide the things. So did you people understand how the things would be going? And do you people understand that how we are going to make it happen? And this has to be a successful attempt. Yeah? Everyone? Would I see the change in your practice? Would I see the change in the participation? Yes, I've got to. Yes, Dr. Sabia. So everybody has to be confident. We all are like a family, no hesitation at all. I'm here to supervise till your examination hall, and even afterwards. You all know me from like previous being together as well. So this is what we are going to create a change. That's like Dr. Sabia. Well done. Atya, I need a change from all of sides, and the group leaders need to take a charge. Your group has to be the best group. Salma, Dalia, every group leader has to ensure that that group has to be the best group out of all, right? So Divya is already ready to fight for ABC groups, yeah? That's perfect, well done. So any questions, my dear? Still, if anything is not clear, please let me know, so that inshallah, Sarwat, so I can make it clear. I'll just be sharing recording in maybe 1 or 2 hours time once it gets converted. So yes, you all have to do that. Any queries, anything is not clear, please let me know.
Sidra, is it like 1 week it will be Friday and alternate weeks will be?
Yes, yes.
Okay,
so one Friday, then Saturday. One Friday, then Saturday.
2 p.m. GMT here will be 7:30.
Yeah. Okay, 2 p.m. GMT, we have finalized the time so that it's not very late for my Malaysian students, and it's not very early as well for all of you as well. So it's going to be the 2 p.m. GMT, all right?
Okay, thank you.
Okay, thank you very much. So Harshiba, I'll see the time. I've posted the stations. It's going to be all the announcements I'll do in the main group, and the mini group would be for practicing. So announcements I'll do in one group so that you all can see there. So the topics which I have to post, like the resources for the topics as well to prepare, I'll also do that in the main group. Okay, right? So this Friday, we are going to meet up. Today is Saturday. So you've got Sunday, Monday, Tuesday, Wednesday. In 4 days, you have to prepare these topics. Thursday, do a very good revision of all topics so that you all are ready for the presentations. Okay, done? Should we call it a day, friends? A wonderful, happy meeting. Thank you very much for all of you. So we are going to make it happen. From today, we are going to take this, this motto that nothing but successful we all have to be. And I'm sure if you're going to have faith in yourself, you're going to make you realize that it's doable. I'm going to do that. You all would be successful, and we are going to celebrate it together in meeting as well. Okay, thank you very much, all of you. It was lovely meeting you all. If still you have any queries, I can address all that in the mini groups as well. Thank you very much. We all would make it happen. Love you all.
Dr. Sidra. You gave a good spirit to us.
Oh, thank you very much, Sarwat. I'll keep on doing that every week with all of you. So keep motivated and keep going, my dear. I love you all. Take very good care of yourself. Have a good night. Bye-bye from my side. Bye-bye. Thank you.
Bye-bye. Bye-bye. Thank you.